Good morning, everyone.
Good morning.
Is the 14th and 9 a.m. and we are going to work on H612 miscellaneous cannabis.
Is it 50?
The 14th. Friday, 3.14.
That's right. You told me.
And Michelle Childs. So glad to have you here in Ways and Means. It's been a while. And would love for you to tell us about the work at GovOps.
Sure. So for the record, Michelle Childs, Office of Legislative Counsel, and we're taking a look at the amendments that came out of House Government Operations. And it isn't too long, but it does have a lot of moving pieces. So I'm just going to go very quickly, kind of high level, tell you what each section does. I know you have Brenda here who's going to testify, so she can give some of the reasons why the Cannabis Control Board had asked for some of these provisions. And I'll especially highlight for you areas that impact the money. So section 1 is amendment.
Sharing your screen with us?
Oh, I'm sorry.
I didn't mention that before.
So section 1 is an amendment actually in the agriculture title. So cannabis, the regulation of commercial cannabis and the medical program are actually in Title 7. But there is some overlap between hemp and cannabis, and those words are used, those terms are used. You might recall in the last couple of years, the General Assembly gave the Cannabis Control Board the authority to regulate THC products that were derived from hemp, as well as things like Delta 8, things like that. Those products, a lot of products coming from out-of-state operators into Vermont. And so there's some language here that is tweaking the definition of hemp products in Title 6 for purposes of trying to kind of close some of the loopholes around those kind of unregulated products that are coming in from out of state. And Bryn can talk to you a little bit more about that and why they feel this language is necessary. So section 2 is something else that the board had asked for. So there's a requirement under Vermont law that's been in there since you established the commercial program in 2020, requiring the Cannabis Control Board to do criminal background checks on folks who were applying for licenses. And they've had difficulty working with the federal government in terms of obtaining those NCIC criminal background checks. And it's not just Vermont, there's a number of states that are in the same boat. And so we've kind of gone back and forth trying to tweak our language to comply with what the feds want. And so this is the latest strategy of doing that. And there's a few other states that are trying this language as well.
Does it have any does it make any substantive changes?
It has to do with how they consider, who they consider to be is controlling the license, how they identify that. And she can kind of Bryn can get in a little bit more about kind of their efforts to try to meet the Fed's requirements. But I know it's been difficult for them, and they've been working with a lot of other states to try to remedy the situation. So section 3, this is a section in the chapter on cannabis establishments. When I talk about cannabis establishments, I'm talking about the commercial adult use cannabis program. If I say dispensary, I'm talking about those entities that are licensed to serve medical patients. So we have 2 programs. Both are under the authority of the Cannabis Control Board. The only change to prohibited products I know has been a really kind of controversial hot topic. Vermont does in the adult use market prohibit certain types of products like flavored vapes, and they have concentration, they have THC caps on concentration, on flower, on things like that. But the only change here in this section 3 is related to something that you'll see a few places in the bill, which is that the board had requested that the legislature allow retailers to get what they are calling a medical endorsement, because there are just a handful of medical dispensaries throughout the state, but there are many, many more retailers serving the adult use market. So if you are on a patient or a caregiver who is on the medical registry and you want to obtain certain products from the dispensary, or you want to work with someone who's more knowledgeable about using it for pain management or something like that, you have to go to a dispensary that may be 2 hours from your house, while there may be an adult use retailer that is around the corner. And so the idea is that someone who is licensed as a retailer could apply to the Cannabis Control Board to obtain essentially a medical endorsement so that they could, under rules developed by the Cannabis Control Board, be able to serve medical patients as well.
I'm sorry, I don't know the answer to the question I'm about to ask you, but is medical cannabis subject to the same taxes?
No, medical cannabis is not subject to taxes.
And I guess this might be more a question for Bryn, but was there conversations about how a retailer would sort of handle that?
I think probably Bryn can talk about that, and I think they are, they're looking at kind of the structure for how they do dispensaries. How do you kind of import that on a much smaller scale to a retailer, but still maintain those separate systems? Yep. And so the only thing that's changed in this prohibited product section is just clarifying that when it's saying that these types of products are banned for a retailer, that doesn't apply when that retailer who has a medical endorsement is serving a patient, because those patients can get certain products that are available through the medical system that are not available to folks in the adult use system. So that's the only change to the prohibited products. It's not doing anything else around caps for everybody else or things like that. Yeah.
Does it work the other way? A medical marijuana establishment, can they sell adult use recreation?
No.
I thought the idea was to assist those medical ones because they're unlikely to survive because of the availability of the adult use ones outside of the medical.
We can ask Bryn more about that.
Okay.
But we allowed them to get retail licenses, which is.
Right. And
Say that again?
We can talk more with Bryn about that, but there was a mechanism built in to work on that.
right.
Okay.
Right. They can have an integrated license where they serve adult use. And that's a separate license. They wouldn't be doing it through the dispensary license. And then also you'll see later is, and here is lowering the dispensary fees. And the board has continually put forth a number of changes each year trying to make the medical program more sustainable, because you do have in 2020, when you established the program, there is language in there saying that it's a priority of the legislature to continue to maintain a medical program in dispensaries in order to serve patients who have different needs and who might not feel comfortable going to a retail establishment. So section 4 is rulemaking. There's a lot of just a few pages here of just existing law, and I just have that because the way that the rulemaking is established in this law is that subsection A applies to all of the cannabis establishments with regard to what the board has to adopt rules on. And then there it goes specifically and says, well, for each other type of license, it talks about specifics for that. But sometimes when people just see retailer has to do this, they think, oh, but what about security, or what about age verification, things like that? And that applies to everybody. But if you look at page 8 on subdivision 5 for retailers, you'll see there's a couple new things with regard to rulemaking, which is the board is to establish rules around location or siting requirements that increase geographic distribution of new cannabis retail establishments based on population and market needs. So kind of looking at and saying, well, do we just have these clusters in certain spots? And should we consider about kind of trying to even that out a bit? And then subdivision G is they have to adopt rules regarding requirements for the medical use endorsement, including rules requiring access for patients who are under 21 years of age. Because 21 years of age is the threshold for being able to possess cannabis in Vermont or to purchase it from a licensed retailer. However, in the medical system, they do have patients who are under 21 years of age. So section 5 is on the retailer license. And so you'll see the new language having to do with, scrolling there. So top of page 11, subsection E is just clarifying that delivery is not available in the retail market. However, it is available in the medical market. And so if you have a medical endorsement, you could be serving just those medical patients. Subsection F talks a little bit more about the medical use endorsement. And that would permit the retailer to sell tax-free cannabis and cannabis products to register patients directly or through their caregivers. And those are things that would not be available to their other customers. They could also be selling different types of products. They can also sell more cannabis or cannabis products to those patients or caregivers because the possession limit is different under the medical system. You can have 2 ounces in the medical system as opposed to 1 ounce for other folks or under retail. They would be able to deliver cannabis and cannabis products to the patients and caregivers. And they would also be allowed to bring it out to them in the car. So some patients who have mobility issues right now with the medical system, you're allowed to kind of make an appointment with a dispensary, arrive at the dispensary, and they'll come out and they'll deliver it to your car so you don't need to go in. So they're just trying to take some of, the pieces of what exists for a dispensary and then allow a retailer to do that for folks who are on the registry. Yeah.
So when you say deliver to their car, that's not deliver to their house.
There is delivery, yes. Delivery to someone's house is permitted under the medical system currently. I think there's maybe only 1 or 2 that actually do that. And so that's currently allowed under current law. And so this is just saying that if you have a medical endorsement and you chose to deliver, that you could do that to patients. Yes.
So if somebody is under 21 and has a medical card,
Mhm.
can they enter a adult,
No.
even if it has a medical endorsement?
Well, that's what the board is going to be looking at through the establishment of rules. It was about how you kind of separate that out. So the things that they talked about might be that there are separate hours that are set aside for when they're serving medical patients and caregivers, or it could be the same facility, but this is how, one door is through access for folks, and they get carded at the door. And then maybe there's another office associated in the same building where patients and caregivers can make an appointment at certain hours or things like that. So that's one of the things that the board is looking at, the various options, and we'll do through rulemaking. But you can't get past the door in any of these retail shops without getting carded. So page 12, section 6, cannabis establishment fee schedule. So currently retailers have a $10,000 annual licensing fee, and you'll see that would increase by $250 if a retailer chose to get a medical use endorsement. Section 7, this is moving on to the medical program. So you'll recall that in the medical program, you don't get a prescription from your healthcare provider. You essentially have to have a qualifying condition, and those qualifying conditions are set by statute. You have to have your healthcare provider sign a medical verification form that you have this qualifying condition, and that is submitted along with your application. And then that would qualify you to be on the medical registry. You'll see the list of qualifying medical conditions currently, and you'll see on line 16 and 17 that ulcerative colitis is added to the list of qualifying conditions.
A question.
Yep.
So the prescription from the doctor,
Not a prescription.
not prescription.
No, it's not a prescription. It is simply a medical verification form The form is produced by the board, and your doctor or nurse practitioner would fill it out that you are a patient of theirs, and they're verifying that you have one of these qualifying conditions. They're not prescribing cannabis for you. They're not, saying we want you to, they're not making any kind of attestation other than they have examined you, you're their patient, and you have cancer, you have ulcerative colitis, you have Crohn's, you have whatever it is, and that you fit the requirement under the definition of qualifying medical condition.
So is there a database? I've got my medical endorsement, whatever, from the doctor, and I go to a shop and get what I need. Okay, and then the next day I can go to a different shop. Is there something to keep a track of that, like a prescription would be?
You would have to ask probably Bren about whether they track anything like that, but typically everybody if you're in the medical program, you have a 2-ounce limit of what you can possess by being on the registry. If you go around to a different store every day and do that, you're essentially in violation of criminal law, as well as your status on the medical registry. I think probably the board can speak to how they address that, or if they address that or ever see that. Page 13, section 8. So this is on registration fees for folks who are either patients or caregivers. So it used to be that patients would have to register every year and pay a $50 fee to be on the registry. And then last year, the legislature changed that so that folks would only have to do it every 3 years, unless the reason why you were on the medical registry was because of chronic pain. And so if you're on chronic pain, you still had to do it every year. If you were on there for cancer or HIV or some other reason, it would be every 3 years. And so this is making it 3 years for everyone.
Yeah. Just my intellectual curiosity, why is chronic pain treated differently?
And not anymore.
Oh, got it. I think I misunderstood.
This is changing it, so it's all the same.
Sorry, I totally misunderstood.
Great question, because that doesn't make any sense.
Correct.
So section 9 are dispensary fees. So you see currently the application fee is $2,500. That drops it down to $1,000. And the current annual renewal fee is $25,000. And it's being lowered to $5,000. So again, this goes to the issue that you brought up around, the board looking for ways to kind of keep the medical dispensary sustainable and people involved in providing these services. Section 10 and section 11 are just technical, cleanup language, nothing substantive there. Just getting rid of some old language. Section 12, this is an amendment to the fire code laws. And there is a list of certain types of buildings, and specifically around farm buildings, that don't have to comply with all of the fire code things around having sprinklers and exit signs and things like that. And so this is adding new language to that exemption language around farm buildings. So it would be exempt from certain fire code requirements around farm buildings that are used in outdoor cultivation for cannabis by someone who's licensed. So page 15, so sections 13 and 14 have to do with the taxes. You'll recall that you have a 14% excise tax on cannabis and cannabis products that are sold through the adult use market. You also have a 6% sales tax on that cannabis and cannabis products. Again, those taxes do not apply to cannabis and cannabis products that are sold through the medical system. And the only changes to these sections are to clarify that if it is a retailer selling cannabis and cannabis products to a patient or caregiver, that that would not be subject to these taxes, just like if it was a dispensary selling those products to a patient or caregiver. So section 15, this is, might look familiar. We had the same language in the miscellaneous cannabis bill last year. So there is a social equity program within the Cannabis Control Board. And this is transferring $500,000 from the Cannabis Regulation Fund, which is where all of the fees and the taxes currently go, to the Cannabis Business Development Fund. And then that $500,000 being appropriated further from the Cannabis Business Development Fund. I don't know what that 19 is there, but to the Agency of Commerce and Community Development to fund the technical assistance that's provide loans and grants to the social equity applicants. So you did the same exact thing last year. So section 16 has to do with with cultivators and setbacks. And I will do my best to explain this to you in simple terms, but I'll just let you know, Bill Grady is really the one with expertise around
From Essex.
around land use and, and zoning. And so what this is doing is saying that, so there are certain restrictions on municipalities regulating these businesses. And you'll see the new language there, starting on line 6 on page 18, is that it's establishing in statute minimum setback distances between the cannabis plant canopy, which is basically the planting area, and a property boundary or edge of a highway. And so if the cultivation occurs in a cannabis cultivation district, and we'll go to the next section in a minute where towns can essentially set those cultivation districts. So if it's in the cannabis cultivation district, the setback is to be not larger than 25 feet as established by the municipality. And if it's outside the cannabis cultivation district, the setback shall not be larger than 100 feet. And so this is to address issues where, you might read in the news or such that like small cultivators maybe being in high density areas and there not really being much of a buffer between them and their neighbors. And then you'll see there on line 16 is that if municipality doesn't have zoning, then there's just an automatic default that the setback is to be 10 feet.
Yeah.
I think it's important for people to understand that those setbacks are up to, so like no municipality is required to like do anything if they don't want to, but those are just some things they can consider.
Right. And then section 17 is providing the authority for a municipality after consulting with their municipal cannabis control commission, if they have established one, can adopt a bylaw identifying a certain cannabis cultivation district saying, here's our town. We think this area over here is more appropriate for cannabis cultivation, whereas this area over here may be more high density residential, less appropriate. And so they can establish what that district is, and then those setbacks would follow that we just talked about. And then the effective dates, everything is to take effect on July 1st.
Representative Anthony?
I wanted to wait to see the effective dates. My query, following several constituents' interest and concern about the mixing of retail and medical, of course, and the fact that there's obviously a separation both from our fiscal responsibility view and the regulatory view of eligibility. I'm curious whether there's an implied because I haven't seen anything in the dates by which the Cannabis Commission has to have promulgated the rules that are articulated here, which essentially clarify that separation, as you say, separate entrances, separate books, accounting, however, to implement the marrying, if you will, of retail and medical. If it all takes place the same date, the rules would not be preceding the effectiveness of the statute. And that, for me, is, maybe this is a Bryn question, but
Right. I
it
think
seems
that's,
to me the
I think
rules
it's
should,
probably a Bryn question. I would say we didn't really, from my perspective of working on this area,
Sure.
whatever, Cannabis Control Board has been on top of doing their rulemaking before they start anything. So I think
Okay.
it really has just been how they've communicated with the General Assembly and how they've done this and worked with LCAR as well and kind of getting their rules set before they move forward on anything. So I don't think it's kind of like piqued anybody's interest that they would kind of start doing anything without the rules. But I hear that because I know that that's been an issue with some agencies.
just a caveat, because I was on GovOps at the setup, I knew that the dates were staggered, so the rules preceded the implementation.
Mhm.
I'm glad to hear that they're eager to make sure they have rules before they open the gates, but there's nothing in here which obliges that. That's the only
Correct.
thing I was pointing out.
Correct.
Thank you.
I'm sorry, I just called you Bryn. Hi, Michelle. Thank you. Bryn, would you like to join us and explain things? Welcome.
Hello, good morning, everyone.
Good morning.
So for the record, Bryn here, Executive Director of the Cannabis Control Board. I'm sorry I couldn't be there in person today, but here to answer any questions the committee has. I can go through and sort of briefly address each section and the policy rationale for each section, if that would be most helpful. Or I can sort of start to address the questions that arose during Michelle's testimony, whatever the
I
chair.
think if we could start by your thoughts on the new fees and how you're going to cover your costs with them, and then we can go into other things.
Sure.
If that's okay with you.
Absolutely. So let's see, the new fees, I can go to the actual language in the bill. A number of fees have changed in this bill, and the first thing I think I would talk about is the reduction in the fees for the medical dispensaries. So that's in section 9. So the fees as they're set forth now for the standalone medical dispensaries that are the dispensaries that serve only our registered medical patients are a $2,500 application fee, which is a one-time fee, and then an annual renewal fee of $25,000. So the proposal here is to reduce those fees so that they're more in line with the adult use market. So to drop the application fee down to $1,000, which is our application fee that we've set for the cannabis, adult use cannabis establishments, and to reduce that $25,000 annual fee to $5,000. So Michelle, I think, did a great job of describing sort of the overall goal of the CCB in amending the medical, sort of amending the statutes governing the medical program. Because as we transition to the adult use market, it's really a difficult business model for these standalone dispensaries to continue to operate. So our adult use retail establishment fee is $10,000. So we would be reducing it to essentially half of what our adult use retailers have to pay for their license fee, their annual renewal fee. So that is really an attempt to make this a more sustainable business for the standalone dispensaries. And then the fee associated with the medical endorsement that retailers would have the opportunity to get if they wanted to provide that service to the medical patients is really a nominal fee. So if you wanted to become a retailer with a medical endorsement, your fee would be $10,250. So essentially it's like this nominal $250 additional fee on top of the $10,000 retailer fee to be authorized to sell to medical patients. And I think that those are the fees that have changed, but remind me if there's anything else. I think that that's all for the fee changes.
No, I think that's it. I'm just curious how that might shift your experience of your budget
So I
and the
don't.
work that you all need to do.
Sure. So I think that as this committee well knows, our fee structure was not created in order to completely cover our costs. And that is true of every other adult use cannabis program in any other adult use state. So essentially, if we did set our fees in a way that would cover all of our expenses, the adult use program would probably be too expensive for most people to participate in. So in general, our fees don't cover our costs, and that's why a portion of the excise tax revenue is sort of devoted to covering the regulatory burden of the agency. The costs associated with providing a medical endorsement for a retail establishment, I think is going to be relatively minimal. As Michelle described, the retailers who obtain a medical endorsement will be required to set up their business in a way that can accommodate medical patients. And that could take multiple forms, as Michelle described. It could be, if you are going to meet those confidentiality requirements, either you set up your brick and mortar establishment to accommodate patients in a confidential way. So either there's a separate entrance, or you could create different business hours to serve medical patients. So as the board goes through its rulemaking process, we will sort of flesh out what that looks like. But the goal is really to provide opportunities for these businesses to provide these services in a way that works best for them. But in terms of the work of the CCB, we're going to be out there inspecting these retail establishments anyway. We are, required by statute and required by our own rules to go and inspect cannabis establishments at least annually. We do that. We typically do it more than annually. So I think that the sort of regulatory burden on the agency, like our responsibilities that are increased as a result of the medical endorsement, are not going to be significant. So I think that $250 sort of nominal fee will be sufficient to cover any additional costs.
Okay. And then one of my questions that I think I asked before, how retail establishments are going to sort of essentially operate their registers for some things that are taxed and some things that are not. I know lots of businesses do that all the time. I'm just sort of curious if that's something that you're working with.
Yeah. So, one of the reasons why we requested this, the effective date for the medical endorsement section to be a year from now is to give us plenty of time to go through our rulemaking process. And as this committee, I think, knows, the CCB is very engaged with stakeholders in our rulemaking. I think that our initial round of rules received more public comment than maybe any other administrative rules that have gone through the process in recent memory. So we take that sort of public engagement process very seriously, and we'll hear from businesses, or we're sure that we will hear from businesses during that process. Any concerns about how they're going to collect taxes for adult use customers and not for patients. I can say that we haven't heard any concerns about that yet. And the bill does provide that retailers that are selling cannabis tax-free, they do need to retain information pertaining to each exempt transaction as required by the Commissioner of Taxes. So I know that is accounted for in the bill, and we haven't yet heard any concerns from the retailers about that requirement. But I'm sure if there are concerns, we will hear about them during rulemaking.
I definitely appreciate how deeply collaborative the control board and the folks that you serve are in communication with. Yeah. So.
Hi, Brent. Do you anticipate any harm done to the existing dispensaries?
I think that the harm to the existing dispensaries is already underway. And I think this has really been true in every other sort of adult use state, that the transition from a medical cannabis program only to a recreational or adult use program is pretty hard on the standalone dispensaries. So I would say that harm is already there. And I think that those businesses are really are are really struggling in that transition. So, part of the goal with this bill is to ensure that at least their regulatory costs are reduced.
Other questions for folks?
Would maybe take us in a slightly different direction. Thanks for the feedback on this bill, Bryn. I know we've talked about this a little bit before, but have heard from some of my constituents' concerns around other fees and wondered whether the Cannabis Control Board would want to seek any other kind of updates now that we've had a little time to see how fee licenses play out, and just name that the issue that I've heard from constituents on is the difference between outdoor and indoor grower licenses, and a sense that the differentiation between the licenses doesn't adequately reflect the value of a harvest difference between an indoor and outdoor growing situation. That both outdoor growers face more risk. They're not able to turn as many crop yields in the year. And so just, I would love to hear whether that's something you all have heard about and think warrants additional updating now or at some point in the future.
Yeah, thank you. That's a great question. And when the board initially came to this committee to propose a fee structure 2 years ago, I think that it was certainly our intent that we would be evaluating these fees as time went on, especially as we had a better understanding of what the regulatory costs associated with each license are. And we have heard some concerns about particularly the difference in cost for the indoor cultivation license versus the outdoor. As Representative Sims points out, typically an indoor cultivator gets about 4 yields a year, can get up to 4 yields a year, whereas an outdoor cultivator really can only get 1. So there has been some conversation at the board level about whether there should be sort of a straight 4-to-1 like cost of the fee, given those differences in yields. But the board is also, aware that indoor cultivators have a lot of other regulatory costs that outdoor cultivators don't have, and just sort of, business operation costs, including sort of HVAC systems and lighting and security systems and other additional cost pressures. So given, the desire for the board to really have a fair fee structure, they've decided to work with the Tuck School of Business over the spring and summer and into the fall on sort of a comprehensive analysis, a deep dive into what are the regulatory costs associated with each of the different license types, so that they can have a better picture and offer sort of a more comprehensive proposal to the legislature next year on the fee structure. So the idea really is looking especially closely at the small cultivators and what their regulatory costs are, because obviously that is really the focus of the Vermont cannabis system. But it will also sort of take a comprehensive and broad stroke look at what are the regulatory costs associated with every different license, so we can provide a more comprehensive proposal. If we need some changes to that fee structure, we can offer a full proposal, so you're not sort of picking at different fees one at a time.
That is really helpful to know, Bryn, because I've been looking forward to that conversation. And so it makes sense that I know that the dispensaries and the patients of dispensaries have like a very urgent and immediate need. And so I appreciate that we're responding to that and can wait on the rest of it. Representative Anthony?
Yes, thank you. Welcome, Bryn. My question of Michelle, which may be more appropriately posed to you, had to do with the rules preceding the implementation of the wedding of the retail and medical. In particular, our venue separating, if you will, the accounting and auditable record keeping for the fees, because of course it's different depending on whether the purchaser is a medical customer or at large retail. And I'm not clear from the bill whether the rulemaking will proceed in adequate time so that the record keeping is ready to go, ready to be examined from the get-go.
Yeah, that's a great question. And like I said before, it was our goal to push the effective date out a year to give us time to accomplish rulemaking. And that's what we did last year when the legislature authorized the new license type for propagators. We gave ourselves a full year to go through the rulemaking process and make sure that our system, our sort of licensing portal, is updated to accommodate the new license type or the endorsement type. So it's on our agenda. It's on the board's
Thank
agenda to undertake
Okay.
starting in the summer.
Great.
Representative Brannigan. And this is going to be the last question for Bryn, and then we're going to hear from Joint Fiscal Office and likely probably not take action on this bill until next week if possible, so that people have some.
Okay, hi, Bryn. So I'm curious about the thinking behind the initial setting up the fees and the acknowledgement that the folks who were around the table at that point they weren't concerned about making books balance, about paying all the costs. What was behind that? I know you have some history with fees, and it seems like some fees are always being adjusted to better reach the actual cost to government to provide the service or the good. But now we have a set of goods that we are not trying to cover that cost. Why?
Yeah, thank you for that question. And I could have been a little clearer when I answered the previous question. Part of the goal of the initial bill that created the Cannabis Control Board and established the adult use program in Vermont, the policy goal was to encompass as much of the illicit market or the legacy cannabis market as possible, to sort of sweep in as many of those folks that had been providing cannabis illicitly to Vermont consumers historically. So the idea was really wasn't just to create this new marketplace for new people to join it, but it was to ensure that all of those folks that were formerly operating came into the regulated space, and we're providing their product in a way that was compliant with all of the regulations that the legislature set out and that the board created as well, to make sure, first of all, that product was not going to minors, and that product was tested and safe, and product abided by the the serving size limits, and was packaged appropriately, and was subject to this sort of enormous network of health and safety regulations that the legislature came up with and the board enforces.
Okay,
So
very different. Thanks. I'm glad you brought that up.
sure.
Thank you so much for joining us, Bryn. Really, really appreciate it.
Thank you so much for having me. I'll see you all soon.
Hi, Ted.
Hello. Good morning, Ted Barnett, Joint Fiscal Office. Good, that is nice and large. So there are quite a few moving pieces in this bill between changes to fees, which would impact special fund revenues, and then also estimating the number of people who may become patients due to the medical use endorsements for retail establishments. And so I'll start with the special fund fiscal impacts that are estimated in fiscal year 25. First, adding ulcerative colitis as a qualifying condition. Currently, there are 59 patients that register with Crohn's disease. So using that as a similar number, we're estimating there may be approximately 50 patients who qualify with ulcerative colitis. And so that's a negligible positive revenue impact for that piece. By extending the patient registration card renewal period for chronic pain from every year to every 3 years, That would impact slightly more than 2,000 patients in the medical program. The current fee for that is $50. And so the total revenue loss in fiscal year 25 would be just a little bit more than $100,000. Reducing the medical dispensary fees. This would take the $2,500 application fee down to $1,000 and the $25,000 annual renewal fee down to $5,000 because there are 5 dispensaries and we're not anticipating any changes in that anytime soon. The annual revenue loss is $100,000, those fees. So for a total in fiscal year 25, that's just a little bit more than $200,000. The moving to excise and sales tax pieces. This is going down into the next table. In fiscal year 25, this is the negligible revenue loss could be from the expansion of medical patients since they don't pay taxes. That's a very slight piece for the ulcerative colitis patients if they were previously participating in the adult use market and moved to the medical side. Very small piece. Wanted to flag that. The revenue starting in fiscal year 26, this to go into the estimate a little bit, it requires with trying to estimate how many additional patients would participate. And we use, starting as a proxy, the number of medical patients that existed before the adult use market, and then did a kind of ramp up adjustment that in the first year in fiscal year 26, folks maybe not, there would be a limited number of dispensaries who would do this because of the associated changes to their business. And there may not be as many medical patients who participate in this side. So we are estimating $160,000 in general fund revenue loss from lost taxes and $70,000 in lost sales tax for medical patients. That revenue increase. So when I say up to, this is assuming that the number of medical patients rejoined where it was before the start of the retail market. It is possible that folks who move from the medical market to the adult use market that is meeting their needs, they don't switch back to being medical patients. So this number, I really want to emphasize that it is an up to revenue impact, but wanted to show the full potential slice. So in fiscal year 27, assuming that this piece is kind of operating at full scale, looking at $550,000 in possible general fund revenue
And
impacts.
does this take into account the sort of the assumptions around the full market growing slightly year over year?
Mhm.
And does that all take into account as Vermont ages, more people might become medical patients? Is that something that we've talked about at all?
No, not really. So this estimate didn't look into that aging demographic piece. I can definitely dig a little bit more into it. And this is, yes, just looking at the number of these revenue numbers came from taking a medical patient and estimating how much they spend, or sorry, an average cannabis user, estimating how much they currently spend on cannabis and the taxes that result from that, and taking the number of folks who move between the adult use and the medical market, their spend translated into taxes. Yep.
Thanks. Other questions?
Yeah.
Yeah, sorry.
Could you remind me what the special fund funds?
I will give a basic answer and let Bryn jump in. It is the Cannabis Regulation Fund, which funds the operations of the Cannabis Control Board. So various regulatory rulemaking.
It's their budget.
Yeah, it's their budget.
Like,
Yeah.
you don't need additional testimony on that. Thank you very much.
Sure.
Representative Mazza and Demmer.
Maybe it was Peter Carolyn's question. I'm amused by the fact that as Vermont population ages, more people are using.
I can't hear you.
Sorry, I'm amused by the suggestion that as Vermont's population ages and more people are using cannabis, there may be less cranky old Vermonters. But anyway,
Reduce the number of cranky old Vermonters.
yes, I said.
Wait, having more cannabis would reduce the crankiness?
People will be more chill.
I love that, Jim.
More
I
chill.
just thought it was worth the
Thanks,
adding that to this conversation.
Jim.
Will that help us get to the crossover?
Ted, can you just talk a little bit more about your, about the idea of people getting their medical needs get met in the adult use market, and what your thoughts are on that, and what your methodology was, that piece of it. I know that's hard to predict and hard to sort of, just, can you share a little bit more about where you went on that?
Sure. Yes, in line with what Bryn mentioned about states who have implemented adult use markets have seen a pretty substantial decrease in the medical patient population, and that has also been true in Vermont. And so understanding that some of the folks who are in the medical market are presumably, they haven't stopped using cannabis, they're just participating in the adult use market instead. And that's because maybe dispensaries are closer. There are only a retail establishment is closer. Want to be clear on that language. There are only 5 medical dispensaries in the state. So you may be in an area that just didn't have close access. And so you had a patient card and maybe you were making the long drive to a medical dispensary in another corner of the state. But now that there's one in your town or right around the corner, the retail market is just a more accessible option for you. So looking at the math, the Cannabis Control Board, their market models, they forecasted what would be kind of a long-term, more natural decrease in the number of medical patients. And we just caught back up with where that would have been, that it was kind of taking a natural decrease from before the start of the retail market. And so this is taking from where we are currently with the number of medical patients and bringing it back up to that number. Or, yeah.
Okay.
Yep.
Thanks.
Yes. Oh, sorry.
Oh.
Can I also comment on special fund revenue impacts in fiscal year 26 and 27?
Would love you to.
Yes. So there would be a slight revenue addition from the $250 additional amount for medical use endorsements. Have to comment on that. And then in fiscal year 27, that is when you'll see kind of once every 3 years, the revenue from chronic pain patients come back. So looking at the revenue loss, which was $102,000, that'll happen every 3 years. So what a comment that that'll happen in 27.
And then, but probably by 27, we will have changed all of the fees. And so, okay. I mean, that's what, they're going to offer us essentially a fee bill next year. So, okay, thank you.
Exactly.
Is there more below? I mean, we only went halfway through the fiscal note. Is there more that we need to know, or is it all?
This is background and details explaining the estimates in the tables.
You used your words to do that out loud. Okay, great. Thank you. Does anyone need anything else on this bill? Okay, we might try to fit it in for a vote tomorrow, depending on the day, and we might not, or if folks want to vote on it now, we can do that now. I have strong feelings at all.
You want a motion?
Is everyone?
Sure.
I can also, does anyone want us to wait?
No.
Okay, I see. Seeing none?
I didn't.
Oh, we didn't warn it. We didn't want to vote. Okay, we will maybe do it tomorrow and maybe do it next week.
All right.
Okay, thank you, Georgia.
Okay.